Hello everyone, I'm Dr. Suresh, Senior Consultant Maxillofacial Surgeon from Gnathos Facial Surgery Center. Often we see patients met with road traffic accidents or fall from steps or fall from sports injury and then sustain injury to the face. They are confused what questions to be asked to the doctor, what information they should get. In this series of videos, we will one by one discuss what information do the patient need to ask the treating doctor. First, you should ask what is the exact nature of injury. Usually, we see three types of facial injuries. One is a skin injury, other is a muscle injury, other is a facial bone fracture. If it is a simple skin injury, debride the wound, clean the wound, and repair with sutures. That itself will heal the skin injuries. If it is a muscle injury, identify the muscle which is injured, bring the muscles back into the normal anatomical position and suture and repair the wound that will heal. Sometimes these muscle injuries can also lead to the facial nerve injuries. Here is the challenge. If someone has got a facial nerve injury, that may lead to a permanent disability. So the earliest time we identify the nature of the injury, identify the nerve, bring the nerve in a proper anatomical position, and then repair the nerve, the facial nerve recovers very fast. If it is a facial bone fracture, then you need to ask your doctor what facial bones are fractured. Usually, the facial bone fractures is a forehead fracture, eye socket fracture, nose fracture, upper jaw fracture, or lower jaw fracture. When someone has got a fracture of the bone, first thing is you should not panic. Ask your doctor what is the type of fracture. Sometimes it is a simple undisplaced fracture. Sometimes it's a very badly displaced fracture. If it is a simple undisplaced fracture, it may recover with a proper rest and immobilization of the fracture. If it is a displaced fracture, then the surgical intervention may be necessary. Usually, the surgical intervention depends on the type and the level of fracture. If someone has got a forehead fracture, then the forehead bones are properly reduced into the position and fixed with the plates and screws. If it is an eyeball fracture or eye socket fracture, then we need to assess the vision of the eyeball, the movements of the eyeball, and the position of the eyeball. Based on that, we have to repair the eyeball socket and fix it with the plates and screws. Now the challenge comes if someone has got a jawbone fractures, whether it is an upper jaw or a lower jaw. Usually when someone has got a jawbone fracture, it also affects the function of the jawbones. That is the alignment of the teeth, mouth opening, chewing ability of the patient. So identify these deformities at the earliest point, bring the jawbone into normal position, thereby alignment of the teeth is also achieved, and fix the jawbone in a proper position. So once you fix with these jawbones, immediately the patient can start performing his normal routine functions like mouth opening, speech, chewing his food normally. So this is what the need of information you should have when someone has a facial bone fractures. Thank you for watching this video. If you find this information is very valuable, please keep following this channel and share this information to the people who are in need.